they will all get help. You got to realize that we know at every step, this is a shared responsibility. And we in the federal government realize that we're going to try to put the subsidies, we're going to try to put the financial help at the various points in the system where it needs help. And in small businesses, they need help. Some with a low level, 10 employees or less than 500,000 annually, they will be exempt. They won't have to provide that insurance. Others will be able to get graduated help as we go. The same thing with individuals. If you've lost your job, that's the other reason, may I just take a moment, of why we need the value of the public option. Because if you don't have that public option in there, then we have no mechanism by which we can assist individuals regardless of their income. If you have no income, they don't have any insurance. Where do you go now? Well, that's why we're expanding the Medicaid allowability so that certain people that are below the poverty level can go there. And if you're 133% above the poverty level, you must only pay, you will only have to pay 1.5% of your income. Subsidies or affordable credits, what we call them, will come in to help you there. We know that health insurance costs going up the ladder. So we have help for people all the way up to 400% of the poverty level, which means a person making $48,000 a year or $83,000 as a family. They will get help and would only have to pay 11% of their income for any health care insurance. So we've got this system in a way so that whatever the circumstances, so that you don't have that burden. And both you and the young lady that mentioned before mentioned the emergency room. That has become the depository of so much of our health care, unnecessarily. So emergency rooms are backed up because we have to take whomsoever comes. That is adding a horrendous cost. Somebody's got to pay for that service. So that's why we're trying to get an equitable balance. And yes, you vote for me, and I tell everybody here, I want you to vote for me again. And I hope that you will understand, I'm in this situation. I know the challenge that is on us as a nation. I know we can't go on this way. And I know this is one of the most complex issues there is. And I also know why there's such an uproar, why everybody is so concerned, because nothing touches us more personal than our health care. I realize this. But I know this too, and I assure you of this. I am going to take into consideration everything I already have. As you see by my opening comments about the medical malpractice insurance. As we see about other things that we pick up, we want everything on the table. I am determined, and I believe we can rise to the occasion in the Congress to get a bill that all factions can work with. You're looking at your congressman here, David Scott. I'm the only member of the United States Congress that belongs to the Congressional Black Caucus, the moderate Blue Dogs, and the New Dems. That covers the waterfront. I'm in all of these groups because I know for us to get something together, we've got to bring the majority of the American people with us. That's what I'm going to be working on. That's why the president, we've met at the White House on numerous occasions, and he's asked me, as he's asked others, help him. Why don't we help the President of the United States, who is taking on this most difficult of issues? As I said before, and I want to end with this, so people will really know where I'm coming from. We had another very divisive issue that came before this nation. It was called the Civil War. Nothing more divisive than that. And certainly would make what we're going through now with these healthcare town halls like a Sunday school picnic. But a conversation took place after that on the back porch of the White House, and the Capitol was almost destroyed. and two gentlemen stood there, Robert E. Lee and Abraham Lincoln. And as they looked out over the expanse of what had happened and what they had to do to bring the nation together, it was Abraham Lincoln who said, "It is not incumbent upon us to complete the task." And then Robert E. Lee added these words, "But it is indicative and a must for us to do all we possibly can." That and those are the magic words. It's not incumbent upon us to complete this task. We can't get a perfect solution to it, but neither are we free to desist from doing all we possibly can to bring down this cost of health care insurance.
Thank you, Congressman Johnson. Now we'll take your questions from those of you that have purple cards. If you have a purple card, if you can line up in the center aisle.
Dr. Payne, I'm a card-carrying AARP member, and I agree with everything you said about we need affordable health care. One thing I disagree is I don't think we need it in 2009. With 5 different programs on the table, I'm sure Congressman Scott was not able to read even one of them completely. Okay, Congressman Scott, I was at a couple town hall meetings in 2007 with you, and the big question at the time was, should the administration spend $80 billion to fund the war in Iraq? Unequivocally, all your people in the town hall meeting said yes. Your next question was, should there be a timeline required for withdrawal? Once again, it was unequivocal. It was a message you heard, no. When you went back to D.C., you voted exactly the opposite. You voted that you would not fund the war unless there was a timetable for withdrawal. You had a mandate from your constituents that said you should not vote that way, and you did it anyway. You told me that it was because when you got to D.C., things had changed, and you had to vote with your heart and your mind, and your soul, and your beliefs. When you have a mandate from your people, you can't go back to Washington and change your mind. Why should I believe anything you say in this town hall meeting? That's a rhetorical question. My real question is, with the national debt going over $9 trillion, how are you, the president said a third of that is going to be paid for by taking exemptions away from insurance companies. That's an insurance increase to me. A third of that's going to come from taxing the people that make $250,000 or more. How many times are you going to tax those people? And a third of it's going to come from Medicare cuts and fine costs in our current program. They were words, paraphrased, out of President Obama's mouth. That's how he's going to pay for the $1.5 trillion health care public option. Can't be done.
Thank you.
Let me try to answer your question on the consistency of the voting. I got to Congress at a time where I stood very strong. I don't think there's anybody in Congress that stood as strong with the President of the United States in the war on terror as David Scott did. I took many hits from both sides of the aisle because I did what I felt was the right thing to do, to stand behind our soldiers. I didn't stay here. I went to Iraq not one time, not 2 times, 3 times, to meet with our soldiers, to meet with both Sunni and Shias. I was one of those that dared to go on the ground to Camp Victory with the threat of my life as well as the soldiers' lives. But I went. I was the one in the plane that went up, and the missiles came after us. And I say thank God for the C-130s because those flares went out and saved my life. When it comes time for anybody, I stand and will stand firm with anybody in my support of our troops and a strong national defense policy and strong on national security. And I stood with President Bush at the chagrin of many in my own party because we were doing what I felt was the right thing at that time. As things moved, as I went to Iraq, and as I continued to go to Afghanistan,